Can we start? Welcome for your talk. And we can
This
start.
meeting is being recorded.
Yes, ma'am. I'll share my screen just a second.
Right. Welcome.
So I believe all of us can see, right?
Yes, we can see and hear.
Yes, ma'am. So good evening, everyone. Thank you so much for joining us today. My name is Keervani Kandala. I'm a second year integrated MSc student from the University of Hyderabad. I'm also a member of the American Lung Cancer Screening Initiative, or ALCSI as we like to call it. I'm joined by my colleague Priyanka Senthil from Rice University. Our presentation today will be on lung cancer and lung cancer screening. Thank you so much for joining, and we are really grateful for the opportunity to present to you today. Before we get started, I'd like to request that everyone is muted during the presentation. We would love to take questions at the end of the presentation, so please feel free to put your questions in the chat box for us to address. If you are interested in learning more about ALCSI, we'd invite you to visit our website at www.alcsi.org and please email us with questions at any time. Before we get into the content of the presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. ALCSI is a nonprofit organization that works to raise awareness for lung cancer and lung cancer screening. We are a team of over 70 students and doctors located throughout the world. We have worked with various educational institutions, hospitals, and community centers. We hope that by educating about lung cancer and its screening, more people will be encouraged to seek lung cancer screening. Today, we'll discuss both lung cancer and its screening, addressing questions such as how common is lung cancer, what is lung cancer screening, who needs screening, how to get screened, etc. So, to begin today's session, I'd like to ask a question. How many of you watch movies? Please raise your hands. All right. Almost all of us watch movies. So, what is the first thing that we see when we watch a movie? Smoking is injurious to health. It causes cancer, isn't it? We find so many people suffering from cancer. But what exactly is cancer, lung cancer, and how is smoking related to it? We'll find the answers to these questions in today's presentation. Cancer is defined as a disease in which abnormal cells divide uncontrollably and destroy body tissues. So then, what is lung cancer? As the name suggests, lung cancer is a cancer of the lungs. Your lungs are two sponge-like organs in your chest involved in breathing and respiration. Now, the cancer that forms in these tissues of the lungs, usually the cells lining the air passages, is defined as lung cancer. Alright, lung cancer is very, very common. It's the second most common cancer in the world. Lung cancer is of two main types, non-small cell lung cancer, which is less aggressive, and small cell lung cancer, which is more aggressive and aggravated due to smoking. Smoking causes most cancers, but non-smokers can also develop lung cancer. Well then, what are the causes of lung cancer? Mainly, lung cancer is due to smoking. Other causes are exposure to secondhand smoke, that is, even if you don't smoke, but you're continuously exposed to it, you have a chance of developing lung cancer. Then, having a family history of lung cancer and occupational exposure to chemical carcinogens like arsenic, chromium, diesel exhaust, etc., are also responsible for lung cancer.
Keervani,
Is my slide not moving?
Yes.
Okay. Sorry, just a second. Is it fine now?
Yes.
Yes, now we can see it. We can see it now. Yes.
Okay. So Now we are talking about the causes of lung cancer. Mainly lung cancer is due to smoking. Other causes of lung cancer are exposure to secondhand smoke. That is, even if you don't smoke, but you're continuously exposed to it, you have a chance of developing lung cancer. Then having a family history of lung cancer and occupational exposure to chemical carcinogens like arsenic, chromium, diesel exhaust, etc. are also responsible for lung cancers. Moreover, infections in the lung like pneumonia, tuberculosis, and chronic obstructive pulmonary diseases like emphysema, bronchitis, etc., they also cause lung cancers. So, what are carcinogens then? Carcinogens are agents which have the capacity to cause cancer in humans. A few well-known carcinogens are asbestos, nickel, cadmium, radon, etc. This graph shows the 2020 statistics of the new cancer cases throughout the world. As you can see, 22 lakh new lung cancer cases were diagnosed in 2020. Now, this graph shows the number of deaths in 2020 caused due to cancer. Lung cancer was responsible for a total of 18 lakh cancer deaths, causing more deaths than breast, prostate, and colon cancer combined. Now, we will see about lung cancer in India. There were 72.5 thousand cases of lung cancer reported in India. It is estimated that by 2040, around 1,20,000 cases of lung cancer could be seen in India, which is like almost double the cases. There were 66.3 thousand deaths due to lung cancer reported in India. According to the World Health Organization estimates, by 2040, around 1,10,000 deaths due to lung cancer could be seen in India. The case fatality rate of lung cancer is over 91.6%. That is, for every 100 diagnoses of lung cancer, it is likely that around 92 deaths are caused due to it. According to the National Cancer Registry Program Statistics Report, 1 in 68 males and 1 in 201 females in India will develop lung cancer once in their lifetime, which shows that the males are more prone to lung cancer than females. Now we can see how huge of a problem lung cancer is, and how should we take methods or initiatives to curb lung cancer. In 2018, 7,84,820 deaths in India were caused due to cancer, of which 8.82% were from lung cancer. Now, out of the people diagnosed with lung cancer, 71.4% were men and 28.6% were women. The northeast of the country had the highest incidence of lung cancer because of its high smoking rate. Now we know that smoking is the biggest risk factor for lung cancer. Now, burden of cancer in India. According to the 2020 report from the National Cancer Registry Program, lung cancer and oral or mouth cancer were the most common cancers among males in the Indian subcontinent. Lung cancer was the leading site in metropolitan cities and the southern region, which can be attributed to tobacco use and air pollution, which are the leading risk factors. A hospital-based study from North India showed that 90% of patients with lung cancer were diagnosed at an advanced stage of the disease, and there was a delay in diagnostic evaluation and treatment. Creating cancer awareness, preventing risk factors, early detection, and improving access to care among people would definitely cause downstaging of cancer. So now I'd like to talk about the stages of lung cancer. Lung cancer is of four stages: early stage, localized stage, regional stage, and distant stage. Early stage is when the lung cancer does not spread much to the surroundings or lymph nodes. Localized stage is when it affects the nearby surroundings and spreads to the lymph nodes near the tumor. Regional stage is when the distant lymph nodes are involved. Distant stage is when the lung cancer spreads to other tissues and organs beyond the region of its origin. We can see that in India, most people are getting screened at distant metastasis state. That is 49.2% in males and 55.5% in females, by which too much of damage would be done. Very few people are getting screened at early stages, that is around 14.2% in males and only 15.3% in females. The majority of patients diagnosed with late-stage lung cancer because they do not start feeling any of the symptoms of lung cancer until the cancer has grown and spread. Now, the most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing and weight loss. However, when people become symptomatic, the cancer has grown and spread to a point where it's difficult to treat and the prognosis is very poor. If the diagnosis of lung cancer has to wait till the patient has symptoms, then it's very difficult to catch lung cancer early. So the question that we ask is, how do we catch lung cancer early if patients are asymptomatic? One of the best ways we can do this is through lung cancer screening. What is lung cancer screening and how is it done? Lung cancer screening is done using something called the low-dose computed tomography or LDCT scan. If you are eligible for lung cancer screening, it is recommended that you get an annual lung cancer screening test. In the coming slides, we'll discuss about who should get screened and how to get screened, etc. Screening for cancer involves blood tests, urine tests, DNA tests, other tests, medical imaging, etc. An important distinction we'd like to make with respect to lung cancer screening is that it is done using LDCT or low-dose computed tomography and not the chest X-ray. We use low-dose computed tomography scan because it provides more detailed pictures than the chest X-ray, and it's better at finding small abnormal areas in the lungs. The picture on the left side is the picture of a chest X-ray. The yellow arrow points to the abnormal area in the lungs, but it is unclear. On the other hand, the image on the right is a picture of a LDCT scan of the chest. The red arrow points to the abnormal area in the lungs. As you can see, the image is more detailed and it is shown with a greater understanding. The question that researchers wanted to answer is, how effective is the low-dose CT scan at detecting lung cancers at an early stage? An important screening trial called the National Lung Screening Trial or NLST tried to answer this question. The NLST was a large national study in the US with over 50,000 patients. So the goal of the study was to determine the effectiveness of lung cancer and how the effectiveness of using low-dose CT scan to detect lung cancer in patients considered high risk. The study included two groups, a group of patients who received an annual LDCT scan and a group of patients who received the annual chest X-ray. By comparing the stages at which the cancers were caught between these two groups, the study wanted to determine if LDCT was better at catching more lung cancers at an early stage. It showed that the participants who received screening with an LDCT had a 20% lower risk of dying from lung cancer than the participants who received chest X-rays. As you can see, among everyone diagnosed with lung cancer, LDCT scan caught most of the lung cancers at an early stage, while the X-ray diagnosed more patients at stage 4. This has important implications for survival. Because of the LDCT scan because the LDCT scan caught more lung cancers at an early stage, these cancers were more likely to be treatable and the prognosis was much better. This translates to a 20% reduction in mortality for those who underwent lung cancer screening using LDCT scan compared to an X-ray. There was another study called the Nelson trial, consisting of patients who received an LDCT scan for lung cancer versus the patients who did not receive cancer screening at all. It showed people receiving LDCT scan showed a 24% reduction in mortality in men and 33% reduction of mortality in women when compared to no screening at all. Here, we'll look at immunity and our body's immune response to lung cancer. So the immune system defends our body against invaders, protects our body, thereby providing with immunity. The role of immune system is defense, that is, against microbes, growth of tumor cells, and destruction of abnormal or dead cells, and maintaining homeostasis, etc. Now, some of the organs involved in this are tonsils, thymus, lymph nodes, bone marrow, spleen, etc. The cells that are involved in our immune system are lymphocytes, T lymphocytes, B lymphocytes, plasma cells, natural killer lymphocytes, monocytes, macrophages, and granulocytes, that is the neutrophils, eosinophils, and basophils. The following molecules comprise the immune system, that is, antibodies, cytokines, interleukins, and interferons. Now, types of immune responses. So, our body has three types of immunity: innate immunity, adaptive immunity, and passive immunity. Everyone is born with innate or natural immunity. It's a type of general protection. For example, the skin acts as a barrier to block germs from entering the body, and the immune system recognizes when certain invaders are foreign and could be dangerous. Adaptive immunity is also called as active immunity, which develops throughout our lives. We develop adaptive immunity when we are exposed to diseases or when we are and then we are immunized against them. Passive immunity is borrowed from another source and it lasts for a short time. For example, antibodies in a mother's breast milk give the baby temporary immunity to diseases the mother has been exposed to. Then, humoral immunity and cell-mediated immunity are two types of adaptive immune response that enable the body to defend itself in a targeted way against harmful agents such as bacteria, virus, cell toxins, etc. Response to cancer cells will be through cell-mediated immune response, which will be discussed further. Cell-mediated immune response involves mainly T cells. Cancer cells are described this way. There are several different types of T cells involved in a cell-mediated immune response, including helper, cytotoxic, and regulatory T cells. With the assistance of the MHC class I proteins, T cells can also help recognize cancerous cells. So, how does this go? First step is T cell activation. All the three types of T cells must be activated by an antigen before they can fight an infection or cancer. It begins when a B cell or a non-specific leukocyte engulfs a virus and displays its antigens. When the T cell encounters the matching antigen on a leukocyte, it becomes activated. The T cell activation requires another leukocyte to engulf a virus and display its antigen. Now, cytotoxic T cells help destroy cancer cells. Once activated, what happens is that a cytotoxic T cell divides rapidly and produces an army of cells that are identical to itself. These cells can travel throughout the body searching for more cells to destroy. The second figure shows how a cytotoxic T cell destroys a body cell infected with viruses. This T cell releases toxins that form pores in the membrane of the infected cell. This causes the cell to burst, destroying both cell and the viruses inside it. A cytotoxic T cell releases toxins that destroy an infected body cell and also the harmful agents that it contains. After it has been brought under control, most cytotoxic T cells die off. However, a few remain as memory cells, which quickly produce many bodies of cytotoxic T cells specific to the antigen if it's repeated again. Finally, regulated T cells come into play and are responsible for ending the cell-mediated immune response after an infection has been curbed. They also suppress the T cells that mistakenly react against self-antigens. So that's about the immune response. Now, here I would like to explain a bit about the treatment methods for lung cancer. So basically, surgery is the most common treatment method for lung cancer to remove the tumor. Then we have radical treatment. Radical treatment is a course of radiotherapy which may be used to treat non-small cell lung cancer if you're not healthy enough for surgery. Then we have palliative treatment, which is a form of treatment for terminally sick people. Like when the cancer has progressed so much that symptoms are treated mostly along with the intended course treatment. Then you have symptomatic type of treatment, which is when only the symptoms are treated without addressing the cause. This is done at maximum progression of the disease. We see that many patients are being diagnosed at distant metastasis state, receiving palliative care, which could be reduced by screening beforehand. So, to talk about lung cancer screening in India, as I explained before, currently there is no lung cancer screening program in India. According to the latest budget 2022, only 2.16% was allocated to healthcare, and there is no division for preventable medicine. However, if some money can also be directed to lung cancer screening, a lot of people could be saved. For this reason, it is important that we implement lung cancer screening in India because the cost of treatment is less and patients' lives could be saved. it was observed that very, very few people are opting to get diagnosed with imaging techniques. That is, only 2% of males and 1.9% of females. Economically speaking, in India, early stage treatment of lung cancer costs around 4 to 7 lakhs, while the late stage lung cancer treatment goes up to as high as 34 lakhs. So around 27 lakhs can be saved if detected early. A low-dose CT scan costs around 4,000 rupees, which can be reimbursed through insurance and healthcare plans. So, as far as the experience of getting a low-dose CT scan goes, it will require you to lay on your back for about 5 minutes. You will be doing something very similar to the patient in this picture. One thing to note is that the process will not hurt at all. There will not be any needles or injections involved. The low-dose CT scan is a non-invasive, fast, and completely pain-free scan. Additionally, the amount of radiation exposure is also very low. Now, current screening guidelines for lung cancer. The United States Preventive Services Task Force has the lung cancer screening guidelines based on the NLST trial. Right now, lung cancer screening is recommended if you're between 50 to 80 years old, or if you're a current or past smoker and have quit in the last 15 years, and you have a 20 pack year smoking history. As a reminder, what is a pack year? A pack year is defined as the number of packs smoked a day times the number of years smoked. This measurement helps to calculate the number of cigarettes smoked over a long period. 1 pack year is equivalent to smoking 1 pack per day for an year. Looking at the example in this slide, there are many ways to get 30 pack years. If you smoke 1 pack a day for 30 years, it is equivalent to 30 pack years. Or if you smoke 2 packs a day for 15 years, then you'll have 30 pack years. Now, how can I get screened? Almost all multi-specialty hospitals in India have screening programs. Government hospitals such as the Tata hospitals, AIIMS, etc. also have lung cancer screening programs. Here's a list of cancer hospitals all over India. I'll paste it in the chat box, just a second. Okay. Private hospitals like Apollo, Fortis, Care, Global Hospitals, all of these have lung cancer screening programs. So how does it usually happen? On the day of your first appointment, you'll meet with a surgical oncologist who will confirm that you're eligible for screening based on your age and smoking history. If you're eligible, a low-dose lung CT scan will be performed, which only takes about 5 minutes. Your scan will be then interpreted by a radiologist who specializes in reading lung CT scans. The patient care coordinator then will call you in the following days to explain the results and discuss any additional medical care that may be necessary. As a part of this program, you can receive a second scan a year later and a third scan the year after. It is that simple getting screened for lung cancer. So, lung cancer screening during the COVID-19 pandemic. We understand that lung cancer screening saves lives, but a question you may be wondering is, can individuals get screened for lung cancer during the pandemic, and is it safe to do so? Yes, during the pandemic, the number of cancer screenings has decreased significantly. However, lung cancer won't stop because of the pandemic. If the patient is at high risk for developing lung cancer, it is important that they get their annual lung cancer screening test. Right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask throughout the process. If patients follow the necessary precautions like wearing a mask, lung cancer screening during the pandemic is safe. The pandemic should not deter patients from getting screened for lung cancer. Now we will see why cigarette smoking is not at all advised and why movies show about cigarette smoking. Cigarette smoking is the #1 risk factor for lung cancer. It also causes 13 other cancers. Pulmonary diseases such as COPD, emphysema, heart disorders, etc. are also caused due to cigarette smoking. Tobacco smoke is a toxic mix of more than 7,000 chemicals. About 85% of lung cancer deaths are thought to result from smoking, and hence cigarette smoking is not at all advised. Additionally, while lung cancer screening has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. Lung cancer screening is not a substitute for smoking cessation. Smoking cessation is one of the best ways to prevent lung cancer and lung cancer screening. And lung cancer screening is the best way to detect lung cancer early. Using both is the best way to fight the disease. For every year after an individual quits smoking, their risk for lung cancer is reduced by 8% to 17%, depending on the kind of lung cancer that they have. Another reason that smoking cessation is important is because it is required by many healthcare programs or healthcare insurances for lung cancer screening. However, we do understand that stopping smoking or smoking cessation can be difficult, and there are a lot of resources for people trying to quit smoking. So, well, this is all about what lung cancer is. Now, how can we reduce lung cancers? Lung cancers can be reduced mainly by lung cancer screening, smoking cessation, and avoiding exposure to carcinogens. So, to summarize the presentation, lung cancer is the most common cancer worldwide and has the highest mortality. However, with lung cancer screening, many lives could be saved. With early detection through lung cancer screening by low-dose computed tomography, we can fight against lung cancer and reduce the number of deaths caused due to lung cancer around the world. As this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase lung cancer screening rate. So now we'll talk about how ALCSI is working to raise awareness and help high-risk individuals getting screened for lung cancer. While lung cancer is the deadliest cancer in the world and its screening can save many lives, very few high-risk individuals are currently getting screened. We are working to address all aspects of these issues. We wrote and advocated resolutions to be passed in the US government, and additionally, we are working to teach communities across the world about lung cancer and lung cancer screening. It is the deadliest cancer in the world, but by working together, we can overcome it and save millions of lives. It starts by working together to raise awareness and initiate lung cancer screening programs in our communities. We believe that by educating communities, especially students, about lung cancer and lung cancer screening, it is crucial, and lung cancer screening is crucial to lowering the number of deaths associated with the disease. They greatly impact and influence healthcare of their parents. Students specifically greatly impact the healthcare of their parents, and we hope that by educating students about the important measures that can be taken, we will not only be able to help only the students, but also the family members as well. So, lung cancer screening saves lives, and if you are interested in helping us raise awareness for lung cancer and lung cancer screening, please reach out. We would love to work with you to save lives. We are open for questions now. So I see a few questions in the chat box.
Thank you, everyone, for listening to the presentation. We're happy to take any questions. I see there's a question in the chat. Keervani, do you want to take this question, or would you like me to? I think we can stop sharing the screen.
Yes. Just a second. Yeah, I think Priyanka, you can take up the questions.
Sure. Okay, perfect.
Thank you, Keervani. The presentation was nice.
Thank you so much.
So the question in the chat says, what are the best scientific methods to discourage people from smoking? And can its effects be reversed by any method or medication? So there are a few different methods that have been developed to help people stop smoking. And one of these is called the nicotine replacement therapy. And its short form is NRT. And so this method gives you nicotine in the form of gum, patches, sprays, inhalers, things like that. But it doesn't give you the other harmful chemicals in tobacco that we see in cigarettes. And so a nicotine replacement therapy can help relieve some of the physical withdrawal symptoms that patients will likely feel if they try to stop smoking completely. And so this helps them gradually stop smoking and reduce the amount of tobacco intake that they take. And so the way this helps is by helping patients focus on the psychological or emotional aspects of quitting. by reducing the physical withdrawal symptoms? Thank you for that question. And then the second part of the question asks, can the effects of smoking be reversed by any medication or method? So the effects of smoking dramatically reduce about 10 to 15 years after a person has stopped smoking. So it takes about 10 to 15 years before a person who smokes risk is similar to that of someone who never smoked. And so it can't be reversed per se, but the effects of smoking can reduce after years of non-smoking. And then Keervani, do you want to take the second question, or should I answer what are the molecular markers of lung cancer?
It would be great if you take it.
Yeah, for sure. So the molecular biomarkers for lung cancer, a few of them that we found are mutations in key like genes, and for example, the EGFR, CRAS, and ALK rearrangements. And so these are usually the common biomarkers and genetic markers for lung cancer. For example, EGFR is a gene that makes a protein involved in cell division, and CRAS helps control the growth of tumors, and ALK is involved in cell growth. So mutations in all of these genes can predispose patients to an increased risk of lung cancer.
There's a question by Swastik Mantri regarding chest radiography. So our chest radiography, I'll take this question. Are chest radiography more time taking and expensive than LDCT? So chest radiography is less expensive. Yes, X-rays are less expensive than LDCT. And as far as time taking is concerned, chest radiography will take a little more time than LDCT scan. But what we want to emphasize is that chest radiography does not give the accurate or exact results, which would only be possible with which would only be given by an LDCT scan, and hence we encourage people to get an LDCT scan and not a chest radiography. That's a really great question. Thank you for asking.
Thank you, Keervani, for a very nice presentation. I hope our students and all the audience would have definitely benefited by your presentation, and it was very well emphasized and very well delivered. And I would also like to thank Priyanka for very suitably addressing the questions, and we are all grateful for the presentation. Anyone else has any questions or remarks? You're welcome. Dr. Deepa, would you like to say something?
Thank you, Keervani and Priyanka. I think it was a very nice presentation, again, as Professor Uma Madam also mentioned it. We do have a few research groups who are working in this area. And and of course, this is a very important area of research and development, as well as I think one of the participants had also asked whether directly whether it progresses to the advanced stage. It's not like that. Any cancer, there is a beginning. There's always an initiation. Only problem is in our country, the diagnosis, the time at which the diagnosis happens sometimes becomes delayed. And therefore, even at the time of diagnosis, the patient has already crossed the first stage 1, stage 2, and he or she is already in stage 3 or stage 4. So the early diagnosis is the key, in most of these cancer management. So if we can develop early diagnostic markers, early diagnostic techniques, it's possible that we would be able to better manage the patients suffering from lung cancers, as is the case with other cancers as well. But in our country, that is the main issue. So if that can be addressed through our R&D, it would be really great. Early diagnosis. Guys, thank you so much.
Yes, ma'am.
And thank you for this awareness presentation. And may I request Professor Rajdeep, Professor Steshna to also comment?
Thank you, Professor Dipa. Actually, we made a mistake. We joined late because we joined in through the link sent by the mail admin.
Right, right.
Yes, but that is the wrong link.
Right.
Then we rejoined from the link sent by Uma ma'am, which is through the Zoom meeting. We missed the first part. I just have a query. When we are talking about lung cancer screening or the most common type of lung cancer, so we have two categories, I think. Keervani or Priyanka, any one of you would be really good if you can highlight on that. There is one non-small cell lung carcinoma and small cell lung carcinoma. So which is the most common one that is happening? Is there any predominant one that is the non-NSCLC is the most common one? And for the smokers, any thought on that?
Yes, that's correct. Non-small cell lung cancer is the most common one. About 80 to 85% of lung cancers are non-small cell lung cancer. So the majority of cancers are NSCLC. The cells in non-small cell lung cancer are larger, but smoking is still a major risk factor for both types. And so that is why like 95% have a history of smoking. And non-small cell lung cancers are larger, but with small cell cancer, the cancer cells are small and round. And so it's a little bit the differences lie in like the structure of the cell. I hope that answers the question.
Yes, Priyanka. So actually, I would also like to add something to that. Our group is also working on NSCLCs. Okay, one of our research scholars just graduated. So what we found out is that from the portal, as well as though we are working on cell lines basically, and also from patient data sets that are publicly available, we found out that lung cancers, specifically NSCLCs, this is for everybody, I'm saying, mutations of P53, it's a very common thing. So there was a question about biomarkers. So we have found out that P53 mutations, NSCLCs that have P53 mutations are more aggressive compared to NSCLCs that have wild type P53. So that is also one of the things that I would like to share, as it is based on lung cancer screening and about biomarkers being discussed.
Yeah, thank you for saying that's very interesting. Yeah.
Thank you so much for that. There are a few questions in the chat. Venkateshwaran asks, at what age should we start thinking about getting screened for lung cancer, and how regularly should we go for a screening? So we'd recommend that if anyone is aged between 50 to 80 and has a 20 Pacquiao smoking history and is a current smoker or who has quit within the past 15 years, they are recommended to go for a lung cancer screening, which could be done annually, like once in a year, and accordingly, they can progress ahead. Thank you for that question. And there is also another question by Swastik. How are lung cancers divided or categorized? So lung cancers are basically divided into two types, like we've just spoken about, small cell lung cancers and non-small cell lung cancers. This classification is based on the microscopic appearance of the tumor cells. So I think that would answer the question.
Yeah, I would just like to add for the question before, if you have if you've been exposed to other risk factors for lung cancer, for example, a family history of lung cancer, or you think you might have been exposed to carcinogens like asbestos and radon, then it would be great to talk to your doctor to see if lung cancer screening is something that you should look into, since it'll vary for different people, and because the lung cancer screening guidelines for the U.S. Are only based off smoking, since it's really hard to quantify, family history of lung cancer or exposure to lung cancer. Those aren't taken into account right now with the screening guidelines. But if you think you might be at increased risk for lung cancer due to other reasons, then I would recommend talking to your doctor and seeing if you know, maybe at least just getting an initial scan would be helpful. So that is always something that you can talk to your doctor about. And then regarding the second question, please let me know if this is what you were going for, but were you asking about the stages of lung cancer and how those are classified into the 4 different stages? Okay, perfect. So the non-small cell and small cell lung cancer, right? Okay, perfect. Yeah. So like Keervani said, it's determined based on the microscopic properties and characteristics of the.
Yes, ma'am. We'll send the recording of the presentation. Definitely we'll do that. Any other
Thank you.
questions? Yes, ma'am. Any other questions?
So if there are no further questions, I would like to thank Keervani and Priyanka on behalf of our Department of Biosciences and BITS Pilani for their very nice initiative in passing the information related to lung cancer screening and the initiatives taken so that there is an early diagnosis of this condition. Thanks a lot. Thank you very much.
Yes, we'd like to thank Professor Sudhir Kumar Barar for giving us an opportunity to present here. And I extend my thanks to Dr. Uma Dubey for being with us every step of the way to conduct this presentation. And thank you to all the other professors and faculty members for joining and giving your inputs. Finally, thanks everyone for listening to us, and do reach out to us. Thanks a lot. Priyanka, would you like to add anything?
Thank you.
Yes, I just wanted to echo everything that Keervani said. Thank you guys so much for giving us the opportunity to present today. We love all the questions that we get, and it's really encouraging to see all the enthusiasm among the students. So thank you.
Okay, thank you.
Bye.
Thank you.
Thanks a lot.
Bye. Bye. Bye.